Today we are going to have a short presentation on the determination of the normal cardiac axis or cardiac vector. It's very simple. If we understand the distribution and the location and the leads, the positive and negative poles of different leads which are applied on the chest and limbs of the patient. So the first thing which is important for the cardiac vector determination is just imagine that this cardiac vector is just like a snake which is rolling on your chest, moving from one side to the other side, changing its vector, its position and its direction, and finally it goes from one side to the other side, making the final direction that it goes like this. So the cardiac vector is just like this. The electrical activity, the resultant electrical activity of the cardiac muscle moves from one side to the other side, but finally it converges and the final vector goes in a specific direction, which is called the cardiac vector or frontal cardiac axis. So the frontal cardiac axis may be imagined by imagining the different leads which are applied on the chest. So this is the frontal plane basically. The chest of the patient is basically the frontal plane on which the leads are applied, and these leads intersect each other at the AV node. The AV node is considered to be the intersecting point of all these different leads, which are bipolar as well as the unipolar. Now, the first thing which is important is just imagine that this is the patient, and this is the right limb, the right upper limb, this is the left upper limb, this is the left leg, and this is the right leg. Right? So first we must understand the first vector, which is the lead one, which moves from the right arm to the left arm. The negative pole is here, and here is the positive pole. Right? The second vector or the second lead, which is running from the right upper arm to the left lower leg, is the lead 2. The negative pole is here, and here is the positive pole. And the third one, which is running from the left upper limb to the left leg, it is lead 3, with a negative pole here and a positive pole here. Now these leads may be imagined as they are intersecting on the frontal plane, just like these markers. For example, this is the horizontal, this is lead 1, this is the positive pole, this is lead 1, and this is lead 2, this is lead 2, this is the positive pole, and this is lead 3. So they are intersecting like this. Right? Now if we look at this on this diagram, this is lead 1, which is moving from this negative pole to the positive pole. Again, this is 2, lead 2 positive, negative, and this is 3, negative and positive. They are intersecting each other at the AV node. This has been imagined that they intersect at the AV node. Now if you look at them, they are making an angle of 60 degrees on all these sides with each other. For example, lead 1 and 2 make an angle of 60, similarly 3 and 1 60, similarly here, similarly here, similarly here, and similarly here. Now this is a circle. This circle makes a total angle of 360 degrees. So the upper, if we divide it into two parts, the lower half and the upper half, this is positive, the lower half is positive, this is negative. Right? Now this is the positive pole, this is the negative pole. These poles have been, these vectors have been further intersected by the augmented leads in the form of the AVF, which is attached to the left leg, the AVL which is attached to the left limb and the AVR which is attached to the right arm. Now they are intersecting these vectors and further dividing these angles 60 degrees, 60 degrees, 60, 60, 60, 60 into further 30 degrees. So these 60 degrees are split by the augmented leads into 30 degrees like this. For example, this is the AVF which is intersecting this 60 degree into 30 degree. So the negative pole is here, the positive pole is here. Again, the LVL intersects the lead 3 and lead 1, making an angle of 30 degree here and 30 degree here and 30 degree here, 30 degree here, right? Again, the AVR is intersecting at this level. This is the positive pole, this is the negative pole of the AVR. So this is 30 degree, this is 30 degree. Now the chord vector is very easy to understand if we understand this way. So the lead 1, lead 2, lead 3, they are intersecting like this. This is 1, this is 2, this is 2, this is 3. 60 degree. 60 degree is further divided by the AVF 30 degree, 30 degree, LVL 30 degree, and the AVR. Now the normal chord vector lies in the range of, so this is plus 90, this is minus 90. If we drag, this is 0, this is minus 30, this is minus 60, this is minus 90, this is minus 150, this is minus this is minus 120, this is minus 150, this is minus 180, right? So this is 0, this is plus 30, plus 60, plus 90, plus 120, plus 150, and plus 180, right? If I look at this, the chord axis or the normal chord vector lies in a range, and the range is from this plus 90, this plus 90 up to minus 30. This is the normal range of the chord vector. So it may lie here, 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 anywhere between the plus 90 and minus 30, which makes the normal chord vector. Now the important thing here is that Dale Dubin has described it, the chord vector lies from 0 to plus 90, but the other books, they have mentioned it ranges from plus 90 to minus 30. This is the normal chord vector. The exact chord vector generally lies at the angle of 59 degree, which is taken generally as 60 degree, and this is actually the lead 2, right? Now this is the normal chord vector. If we look at this diagram, we can even extract the leads and their orientation to each other. For example, I can extract that lead 1 is straight away at 90 angle to the lead AVF, or the lead AVF is at 90 angle to the lead 1. Here 90, again here 90. Similarly, we can just extract that the lead 2, which is here, this lead 2 is lying at an angle of 90 to the AVL. This is lying at an angle of 90 to the AVL on this side as well as on this side. And similarly, other angles, the other vectors, for example, the AVR, this is the AVR, this is the AVR, the AVR, this is 150, so 180, 30, and this is 3. So the AVR is lying at an angle of 90 degree to lead 3, right? So by looking at the diagram, we can just extract the orientation of the different leads to each other, and this is important for the determination of the axis. We will deliver a small lecture on the determination of the abnormal cardiac vector, which is called the axis deviation, and this axis deviation will be determined by 5 methods. So now this is the normal cardiac vector. If the cardiac vector, if this vector lies between -30 here to -90, this is called the left axis deviation. If it lies between the +90 here to the +180, this is the right axis deviation. Right axis deviation. And if it lies between -180 here and -90, in between this area, this is called as the extreme right axis deviation. Some books mention as indeterminate axis. So this is a simple way of